March 7, 1945. Near Remagen, Germany. The bridge was still standing. Through the shattered window of our field hospital, I could see the Ludendorff Bridge across the Rhine. Germany's last defense, the final barrier between the Americans and the heart of the fatherland. It was supposed to have been destroyed. It was supposed to have stopped them, but there it stood, intact, and American tanks were rolling across it. The sound of artillery was constant now, a rolling thunder that never stopped, that vibrated in your chest and made your teeth ache. The wounded kept arriving, and arriving, and arriving, wave after wave of broken men, bleeding men, dying men, carried on stretchers or stumbling on their own, filling every bed, every floor space, every corner of our makeshift hospital in what had been a schoolhouse 3 days ago. I was 26 years old. My name is Anna Hoffman, and I was a Krankenschwester, a nurse, with the 89th Infantry Division's medical company. I'd been trained at the DRK school in Berlin, the German Red Cross, back when there was still a Berlin worth speaking of. I'd served on the Eastern Front for 6 months before frostbite damaged my left hand badly enough that they transferred me west. I'd seen things in Russia that I still couldn't speak about. I'd held boys while they died, calling for their mothers. I'd amputated frozen limbs with inadequate anesthesia. I'd learned that war isn't glorious or noble. It's just meat and screaming and the smell of gangrene. But I was a nurse. I had a duty. I had a purpose. I could save lives, even if I couldn't save Germany. And now the Americans were coming to take that away from me. They won't let you work. My supervisor, Oberschwester Kraus, had told me that morning. She was 53, had served in the First War, and her face was carved from stone and cigarette smoke. The Americans hate us. They'll separate medical personnel. They'll send you to camps. Our wounded will die without care because the enemy wants revenge. I wanted to argue, but I couldn't. Everything we'd been told about the Americans suggested she was right. The propaganda films, the radio broadcasts, the whispered stories from soldiers who'd been on the Western Front. The Americans were led by Jews who controlled their government and military. They wanted to destroy Germany, to erase us from history, to take revenge for imagined crimes. They would show no mercy. But even if that were true, I had patience. 37 men in this building alone, most of them badly wounded. Abdominal injuries, compound fractures, shrapnel embedded in organs. 2 with sucking chest wounds who wouldn't survive the night without constant monitoring. 3 amputations I'd performed myself with a bone saw and morphine we could barely spare. I couldn't leave them. I wouldn't. The Americans arrived at 14:23 hours. I know because I checked my watch, a habit from nursing school. Always mark the time, always document everything. It was a reflex that survived even as everything else collapsed. They came in a convoy of jeeps and trucks, moving fast, efficient, professional. I watched from the second-floor window as soldiers in olive-drab uniforms surrounded the building. They weren't shooting. They weren't burning anything. They were just securing the area, setting up a perimeter. Acting like this was a routine operation. Our senior medical officer, Stabsarzt Weber, went out to surrender formally. He was 48 years old, too old for combat duty. Assigned to medical corps because he'd lost his left eye at Stalingrad. He walked out with his hands raised, no weapons, wearing his white medical armband with the Red Cross clearly visible. The Americans didn't shoot him. They didn't even seem particularly interested in him. An officer, a captain, I learned later, spoke to him briefly, gestured toward the building, and then American soldiers began entering our hospital. I stood in the second-floor corridor, my hands shaking, my nurse's apron stained with blood from a transfusion I'd administered 20 minutes earlier. Around me, the other nurses, 6 of us total, waited in terrified silence. The Americans came up the stairs. 3 of them, rifles ready but not aimed. The first was a sergeant, maybe 30, with hard eyes that had seen too much. Behind him, a medic. I recognized the armband, the cross, the medical bag, and behind them, an officer. The officer looked at us, 6 German nurses in blood-stained white uniforms, standing in a corridor full of wounded German soldiers, and said something in English. None of us understood. Then he switched to German. Heavily accented, American German, but comprehensible. "Medical personnel?" he asked. Oberschwester Kraus stepped forward. "Yes, we are nurses." These men are wounded. They need care. How many patients? The officer interrupted. 37, plus the walking wounded in the courtyard, maybe 15 more. How many critical? Kraus hesitated. I spoke up, my voice steadier than I felt. 5. 2 with chest wounds, 1 with abdominal injury, 2 with severe blood loss. They need immediate attention or they'll die. The American officer looked at me. Really looked at me, not at a German, not at an enemy, but at a medical professional assessing another medical professional. You speak English? He asked in English. A little, I replied in German. Medical terms, some. He nodded. I'm Captain Morrison, U.S. Army Medical Corps. We're securing this facility. Your patients will be treated. Medical personnel will be processed as prisoners of war under Geneva Convention. Do you understand? Will we be allowed to continue caring for them? I asked, the question bursting out before I could stop it. Our wounded, they know us. They trust us. If you separate us, that's not my decision, Captain Morrison said. But right now, I need to assess the critical cases. Show me. I led him through the ward. 37 men in various states of injury and dying, packed into what had been a school gymnasium. The smell was overwhelming. Blood, infection, unwashed bodies, fear. We'd been operating with minimal supplies for weeks. Bandages were in short supply. Morphine was rationed. Antibiotics were a distant memory. We were doing battlefield medicine with 19th century resources. Captain Morrison moved through the ward with professional efficiency, checking each patient, asking questions I translated from German to broken English and back. Behind him, the American medic, a corporal named Jensen, was already unpacking supplies from his bag. Real supplies, sulfa drugs, clean bandages, morphine ampules. Things we hadn't seen in months. This one, I said, stopping at a bed where Gefreiter Müller lay. He was 19 years old. Shrapnel had torn open his abdomen 3 days ago. I'd done what I could. Cleaned the wound, removed the obvious fragments, stitched him closed, but infection had set in. His fever was 40 degrees Celsius. He was delirious, calling for his mother, for water, for death. Captain Morrison examined him quickly, efficiently. Peritonitis, he said in English. Then in German. Infection in abdomen. Very bad. He needs surgery, antibiotics. Without treatment, he made a gesture that needed no translation. Death. We have no antibiotics, I said. We haven't had penicillin in 2 months. We've been using sulfa powder when we have it, but Morrison turned to Corporal Jensen. Get me a penicillin kit and prep for emergency surgery. We'll need to reopen this abdomen, clean out the infection. Jensen nodded and left. Morrison turned back to me. Can you assist? I stared at him. You want me to help you operate on a German soldier? You're a nurse. He's a patient. Yes or no? Yes, I said immediately. Yes, of course. But why? You could just let him die. He's the enemy. Morrison's expression hardened. I'm a doctor. That's my patient. I don't care what uniform he wore. Now, do you have surgical instruments, or do I need to use mine? We had instruments. Barely. I showed him to our surgical area, a corner of the ward with better light and a table we'd commandeered. It wasn't sterile. It wasn't even particularly clean, but it was what we had. Over the next 40 minutes, I assisted an American Army doctor in performing emergency surgery on a German soldier who'd been trying to kill Americans 4 days earlier. Morrison was skilled. Better than Stabsarzt Weber, honestly, with steadier hands and more modern techniques. He worked quickly, cleaning out infected tissue, irrigating the wound with saline, administering penicillin directly into the abdominal cavity. He might live, Morrison said finally, closing the incision with proper sutures. Actual surgical thread, not the repurposed dental floss we'd been using. 70% chance if the penicillin works. Without it, he'd be dead by morning. He looked at me. Good work. You know what you're doing. It was the first compliment I'd received in months. From an American. From the enemy. From someone who had no reason to care whether I was competent or not. I didn't know how to respond, so I just nodded. Over the next several hours, the Americans transformed our hospital. They brought in supplies, real medical supplies, the kind we hadn't seen since 1943. They set up proper triage. They brought in their own medics to supplement our staff. They treated our wounded as if they were their own. And they didn't separate us. This was the thing I couldn't comprehend. We were enemy medical personnel. We'd served the Wehrmacht. We'd kept German soldiers alive to fight another day. By all rights, the Americans should have separated us from our patients, sent us to prisoner of war camps, left the wounded to be treated by American medics who didn't speak German and didn't know the patients' histories. But they didn't. Captain Morrison gathered us, the 6 German nurses and Stabsarzt Weber, in the corridor outside the ward. Through a translator, a German-American private from Milwaukee who spoke both languages fluently, he explained the situation. This facility is now under U.S. Army Medical Corps control. All patients, German and American, will receive treatment according to medical priority, not nationality. Medical personnel, German and American, will work together. You will follow orders from American medical officers. You will maintain professional standards. In return, you will be allowed to continue caring for your patients. Do you accept these terms? Oberschwester Kraus spoke for all of us. Yes, we accept. Good. Get back to work. We have patients who need care. That was it. No speeches about defeating Germany. No gloating about victory. No revenge. Just get back to work. You're medical professionals. Act like it. I went back to my patients and I wept. Not loudly. Not obviously. Just quiet tears running down my face as I changed bandages and administered medications and checked vital signs. Because everything I'd been told was wrong. The Americans weren't monsters. They weren't seeking revenge. They were just doctors and nurses doing their jobs, treating the wounded regardless of uniform, and somehow, that was more devastating than any cruelty could have been. March 8th, 1945. Day 2. By morning, we'd established a routine. The Americans brought in more supplies overnight, whole crates of them, including things I'd only read about in medical journals. Penicillin, plasma for transfusions, real anesthetics, not the improvised combinations we'd been using, sterile instruments, clean sheets, food that wasn't moldy bread and watery soup. They also brought in wounded Americans. 8 of them, casualties from the bridge assault, needing immediate treatment. They were placed in the same ward as the German wounded, separated only by practicality of space, not by nationality. I found myself treating an American soldier, a private from Ohio, shot through the shoulder, bone fragments everywhere. He couldn't have been older than 20. He stared at me with terror in his eyes as I approached with scissors to cut away his uniform. "You're German," he said in English. I understood enough to nod. "Nurse," I said in English. "I help." "You're going to kill me," he whispered. I stopped. Through the translator, Private Schmidt, the Milwaukee German-American, I said, "I am a nurse. I took an oath to help the wounded, all wounded. I will not harm you. I will treat your injury to the best of my ability. You have my word." Schmidt translated. The American soldier, his name tag said Collins, searched my face for deception. Then slowly, he nodded. I spent the next hour cleaning and dressing his wound, removing bone fragments, administering sulfa drugs to prevent infection. He winced, but didn't cry out. When I finished, he said something in English that Schmidt translated. "Thank you. I'm sorry for what I said." "You don't need to apologize," I replied through Schmidt. "You're wounded and afraid. That's normal. Rest now. You'll heal." As I walked away, I heard another American soldier, one with less serious injuries, say to Collins, "Dude, you just got fixed up by a Nazi nurse. How weird is that?" Collins replied, "She's not a Nazi. She's just a nurse." Such a simple statement. Such a profound truth. She's not a Nazi. She's just a nurse. Was I? Had I ever been? I'd worn the uniform. I'd served the Wehrmacht. I'd believed, or tried to believe, what I'd been told about Germany's righteousness, about our enemy's evil, about the necessity of sacrifice for the fatherland. But I'd become a nurse to save lives, not to serve an ideology. And somewhere in the chaos of war, I'd forgotten the difference. March 10th, 1945. On the 3rd day, something remarkable happened. Captain Morrison asked me to assist in a major surgery. Not on a German patient, but on an American soldier, a lieutenant with severe abdominal wounds from shrapnel, internal bleeding, multiple organ damage. It was going to be a difficult operation, maybe 6 hours, requiring someone who knew what they were doing. "You're good," Morrison said through Schmidt. "You've got steady hands and you don't panic. I need that for this surgery. Will you help? You trust me?" I asked. "With one of your own soldiers?" Morrison looked at me with those tired, professional eyes. "I trust your competence. I've watched you work. You know what you're doing. That lieutenant needs the best care we can give him. And right now, you're part of that team. So yes or no?" "Yes," I said. "Of course, yes. We operated for 7 hours. Morrison led, but I assisted, holding retractors, suctioning blood, tying off vessels, anticipating what he needed before he asked. It was the kind of surgery that requires perfect coordination, where hesitation or miscommunication can mean death. The American lieutenant survived. Barely, but he survived. Afterwards, scrubbing blood from my hands in a basin of precious clean water, Morrison said through Schmidt, "You could practice medicine anywhere. Berlin, Munich. You're that good. Why'd you end up in a Wehrmacht field hospital?" "Because that's where the wounded were," I said. "I'm a nurse. That's what nurses do." Morrison nodded. "Yeah, that's what we do." He paused, then added, "When this is over, when the war ends, Germany's going to need good nurses, good doctors, people who remember that medicine isn't about politics or nationalism. It's about helping people who are suffering. Don't forget that." "I won't," I promised. And I meant it. March 15th, 1945. By the end of the first week, our hospital had become something strange and unprecedented. A truly international medical facility where German and American medical personnel worked side by side, treating German and American patients without distinction. It wasn't always smooth. There were language barriers. There were cultural differences. American medics were more casual, less formal than we were trained to be, which sometimes caused friction. There were moments of tension when a German patient refused treatment from an American, or an American soldier reacted badly to being treated by a German nurse. But mostly, it worked, because at the end of the day, we were all medical professionals doing the same job. The wounds didn't care about nationality. The infections didn't care about ideology. Pain was pain, regardless of what uniform you wore. I found myself developing a working relationship with Corporal Jensen, the American medic who'd first entered our hospital with Captain Morrison. He was 23, from a farm in Iowa, and he'd been a medical student before the war. He'd seen action at Normandy, at the Bulge, and now here at Remagen. He'd seen too much death, just like me. We didn't speak much. His German was limited. My English was worse, but we developed a kind of professional shorthand. A nod. A gesture. He'd hand me instruments during procedures without being asked. I'd prep patients for him to examine. We worked together like we'd trained together, even though we'd been enemies a week earlier. One evening, during a rare quiet moment, he showed me a photograph from his wallet. A young woman with a bright smile standing in front of a white farmhouse. "Wife," he said in English. "Mary," I understood. I pulled out my own photograph. My brother Heinrich, in his Wehrmacht uniform, taken before he shipped out to the Eastern Front. I hadn't heard from him in 8 months. I didn't know if he was alive or dead. "Brother," I said. "Heinrich." Jensen nodded solemnly. He understood. We sat there in silence. Two people who should have been enemies, united by the universal experience of loving someone who might be dead because of this war. "War is stupid," Jensen said in simple German. "Yes," I agreed. "War is very stupid." March 20th, 1945. 2 weeks into American control of our hospital, an incident occurred that would change everything. A German officer was brought in, an Oberleutnant, a first lieutenant, with the 11th Panzer Division. He'd been captured near Koblenz with severe leg injuries and possible internal bleeding. He needed immediate surgery, or he would die. But he refused treatment from the Americans. "I will not be operated on by Jews," he said in German, his voice weak but venomous. "I will not let Jewish hands touch me. I would rather die." Captain Morrison, through Schmidt, tried to reason with him. "Lieutenant, you have internal bleeding. Without surgery, you'll be dead in a few hours. I can save your life. You're a Jew," the officer said. It wasn't a question. "I can tell." The Americans put Jews in charge of medical corps to humiliate us, to defile us. I refuse. Morrison's face went very still. I'm not Jewish, he said quietly. But even if I were, I'm a doctor. You're a patient. That's all that matters. It matters to me. The officer spat. Let me die. I'll die a German, not be saved by racial inferiors. The ward went silent. Every eye was on this confrontation. German patients, American patients, German nurses, American medics, all of us watching to see what would happen. Morrison stood there for a long moment. Then he said, Fine. You want to die for your ideology, that's your choice. I won't force treatment on you. He turned to leave, and I heard myself speak. I'll do it. Morrison turned back. What? I'll do the surgery, I said, my voice stronger now. I'm German. I'm not Jewish. I'm a nurse, trained in surgery. I've done abdominal operations before. If he won't let you save him because of his poisonous beliefs, I will. Because I'm a medical professional, and I don't let patients die because they're stupid. The German officer stared at me. You would help a Jewish doctor? I would help any doctor trying to save a life, I said coldly. And right now, that means helping Captain Morrison teach me the correct procedure so I can save your miserable, hateful life. Because that's what nurses do. Morrison looked at me for a long moment. Then he nodded. Okay. We do this together. I'll guide you through it. He doesn't have to know I'm directing the procedure. Over the next 3 hours, I performed surgery on a German officer who would rather have died than be treated by someone he thought was Jewish. Captain Morrison stood beside me the entire time, quietly instructing me in German through Schmidt, guiding my hands, helping me navigate the complex abdominal injuries. The officer survived. He would never know that his life was saved by the exact collaboration he'd refused. A German nurse following the instructions of an American. Possibly Jewish, possibly not. It didn't matter. Doctor. Working together to do what medical professionals do. Save lives. That night, after the surgery, I found Captain Morrison sitting outside, smoking a cigarette, staring at the ruins of Remagen. Why did you help me save him? I asked through Schmidt. He's a Nazi. A real one. He would have let himself die rather than accept help from someone he thought was Jewish. Why waste the effort? Morrison took a long drag on his cigarette. Because he's a patient. Because I'm a doctor. Because the minute I start choosing who deserves treatment based on their beliefs, I become something worse than they are. He looked at me. You did good work in there. You could have let him die. No one would have blamed you. But you didn't. Why? I thought about it. Because I'm a nurse. And nurses don't let people die, even when they deserve it. Morrison smiled slightly. Yeah, that's the problem with our profession. We keep saving people who don't deserve saving. Is it a problem? I asked. No, he said. It's what makes us better than them. We sat there in silence, a German nurse and an American doctor, while the war raged on around us, and I understood something fundamental. This was what victory looked like. Not the triumph of one nation over another. Not revenge or domination, but the choice to remain human, even when it would be easier not to. The choice to save lives even when you have every reason not to. The Americans had defeated us on the battlefield, but they were defeating us more completely in the hospital. Not through cruelty or revenge, but through mercy we didn't deserve, and professionalism we hadn't expected. They were teaching us what we'd forgotten in 12 years of Nazi rule, that some things transcend nationality, some things transcend war, some things transcend even hatred. Medical care was one of them. The Hippocratic Oath was another. And the simple, profound act of treating suffering as suffering, regardless of who was suffering, that was the most powerful thing of all. I was a German nurse, POW. I'd expected to be prevented from helping my own wounded, to be punished for serving the Wehrmacht, to be treated as the enemy I was. Instead, I was being given the opportunity to practice medicine at the highest level, treating both German and American patients, learning from American doctors, and being trusted as a professional despite my nationality. And that broke me more completely than any punishment could have, because it meant everything I'd believed about the enemy was wrong. Everything I'd been taught about inferior races was a lie. Everything I'd accepted about German superiority was propaganda. And the people I'd been told to hate were the ones teaching me what it meant to be truly human. But the real test, the moment that would define everything, was still to come. That moment would arrive 3 days later, when American medics would do something that would make me weep, not from sadness or relief, but from the sheer overwhelming power of witnessing genuine moral courage in action. Something that would convince me that I'd spent the war fighting for the wrong side, believing the wrong things, and that redemption, if it was possible at all, would require acknowledging every lie I'd ever been told. But I didn't know that yet. For now, I just sat with an American doctor in the ruins of Germany and tried to understand how the enemy had become my teacher, my colleague, and perhaps, in some strange way, my salvation. March 23rd, 1945, Remagen Field Hospital. 3 weeks into American occupation of our hospital, I'd fallen into a routine that would have been unimaginable a month earlier. Wake at 600. Morning rounds with Captain Morrison and Corporal Jensen. Check the critical patients, German and American alike. Assist in surgeries, change dressings, administer medications, comfort the dying when comfort was all we had left to give. The work was the same. The patients were the same. Only the context had changed. I was now a prisoner of war, who spent 12 hours a day practicing medicine alongside the people who'd defeated my country. And I was better at my job than I'd ever been under German command. This was the thing that haunted me in quiet moments. With American supplies, American techniques, American support, I was saving more lives than I ever had serving the Wehrmacht. We had antibiotics. We had plasma. We had anesthetics that actually worked. We had food for patients that wasn't starvation rations. We had time to treat people properly instead of rushing through triage because another wave of casualties was already arriving. The Americans had given me the tools to be the nurse I'd always wanted to be, the nurse I'd trained to be before the war consumed everything. But they'd also given me something more dangerous, a mirror that reflected every lie I'd believed, every compromise I'd made, every moment I'd stayed silent while atrocities happened around me. And I didn't know if I could bear what I saw in that reflection. March 23rd, 1945, 14:37 hours. The convoy arrived without warning. 3 trucks carrying wounded from the front lines, which had moved east of the Rhine and was now grinding toward Frankfurt. The casualties were mixed. 12 Americans, 8 Germans, all of them in bad shape, but it was the 13th patient, carried in last, on a stretcher, barely conscious, who changed everything. He was Waffen SS. I recognized the insignia immediately, even though someone had tried to remove it from his uniform. SS Sturman, equivalent to a corporal, maybe 22 years old. Multiple gunshot wounds to chest and abdomen. Massive blood loss. Without immediate intervention, he'd be dead within the hour. Captain Morrison was in surgery with another patient. The other American doctors were occupied. The medics were overwhelmed with the sudden influx of casualties, which left me. I stood over this SS soldier, this man who'd served in the most fanatical, most brutal arm of the Nazi military, and I felt something cold settle in my chest. I knew what the SS did. Everyone knew. The rumors, the whispered stories, the things we weren't supposed to talk about, but everyone knew anyway. The SS weren't just soldiers. They were ideology made flesh. They ran the camps. They executed civilians. They were the true believers, the ones who would burn the world rather than admit they were wrong. And here was one of them, bleeding out on a stretcher, looking up at me with glazed, desperate eyes. "Help me," he whispered in German. "Please, I don't want to die. I should have walked away. I should have called for an American medic. I should have let nature take its course. But I was a nurse. And nurses don't let people die, even when they deserve it. I began triage, checking vitals, assessing wounds, calculating what needed to be done immediately versus what could wait. The gunshot wounds were severe, but potentially survivable with proper treatment. He needed blood. He needed surgery. He needed antibiotics. An American medic, a corporal I didn't know, newly arrived with the convoy, saw what I was doing and approached. "He's SS," the corporal said in broken German, pointing at the barely visible insignia. "Waffen SS. You know what they do?" "Yes," I said, not looking up as I started an IV line. "I know. We should let him die. Save the supplies for someone who deserves them." I looked up at the corporal. He was young, maybe 21, with hard eyes that had seen things that aged you faster than years could. He had every reason to hate the SS. They all did. "He's a patient," I said quietly. "I'm a nurse. That's all that matters right now." "That's bullshit," the corporal said. "He's a Nazi. A real one. He'd kill you without thinking twice if the situations were reversed." "Probably," I agreed. "But I'm not him. And I won't become him just because it would be easier." The corporal stared at me for a long moment. Then he said something I didn't understand and walked away. I kept working. Over the next hour, I stabilized the SS soldier, IV fluids, pressure dressings, morphine for pain. I got his bleeding under control. I kept him alive long enough for Captain Morrison to finish his current surgery and assess whether this patient could be saved. Morrison came out of surgery, still in his blood-stained gown, and looked at the SS soldier, then at me. "You know what he is?" Morrison asked. "Yes. And you still stabilized him? He's a patient. You taught me that. Remember? I don't care what uniform he wore." Morrison's jaw tightened. "That was before I knew there were SS in the mix. These aren't regular soldiers, Anna. These are the ones running the camps. The ones executing civilians. The ones—" He stopped, his professional composure cracking slightly. "We liberated a camp 2 weeks ago. Dachau. You know what we found there?" I didn't answer. We'd heard rumors, whispers, things we weren't supposed to know. "Walking skeletons," Morrison said quietly. "Thousands of them. Starved, tortured, murdered. Medical experiments. And you know who was running it? The SS. This man's organization. Maybe this exact man, for all we know." He looked down at the soldier. "He doesn't deserve saving." "No," I agreed. "He probably doesn't. But if we start deciding who deserves medical care based on what they've done, what they believe, who they are, then we're no different than they are. That's what you told me. That's what you've been teaching me for 3 weeks. Morrison closed his eyes. "God damn it. I can't do the surgery alone," I said. "I need your help. But if you refuse, I understand. I'll let him die. But I need you to tell me that's what we're doing. I need you to choose to let a patient die because of who he is. Because once you do that, I need to know what that makes us." It was the most direct challenge I'd ever issued to a superior officer. But Morrison wasn't just my superior. He was my teacher, my colleague, the man who'd taught me that medicine transcends politics. And now I was asking him to live up to his own principles. Captain Morrison operated on the Waffen-SS soldier for 4 hours. I assisted. We didn't speak except for necessary medical communication. The surgery was successful. We removed bullets, repaired organ damage, stopped internal bleeding. The soldier would survive. Afterwards, while scrubbing out, Morrison said, "You know I hate you for making me do that." "I know. He'll go to a POW camp. Eventually, he'll probably be tried for war crimes. He might be executed. We saved him for that. Maybe," I said, "or maybe he'll live long enough to face what he's done, to understand the horror he participated in." "You can't have that reckoning if you're dead." Morrison looked at me. "You really believe that? That he can be redeemed?" "I don't know," I admitted, "but I know that I can't. I can't be redeemed if I start choosing who deserves life based on their uniform. I have to save everyone. Or I'm just another person who decided some lives matter more than others. And that's exactly what the Nazis did. That's exactly what I need to stop being." "You were never a Nazi," Morrison said. "Wasn't I?" I asked quietly. "I wore the uniform. I served the Wehrmacht. I stayed silent while things happened that I knew were wrong. Maybe I didn't pull triggers or run camps, but I was part of the system. I enabled it, and the only way I can live with that, the only way I can face what I've been part of, is to be absolutely committed to the principle that every life matters. Even his. Especially his. Because if I can save someone I hate, someone who represents everything evil I've enabled, then maybe there's hope for me too." Morrison was silent for a long moment. Then he said, "You're going to make a hell of a doctor someday, Anna. If you survive this war with your soul intact." "I don't know if that's possible anymore," I said. "No," he agreed, "but we can try." March 25th, 1945. 2 days after the SS soldier incident, Something happened that would become the defining moment of my entire war, the moment I truly understood what it meant when Americans let me continue practicing medicine. A German convoy arrived at our lines under white flag. Officers requesting parley under Geneva Convention. They had wounded 63 men, critical cases, overwhelmed field hospitals, requesting medical assistance from American forces. It was unprecedented, the German army, asking for help from the enemy. Captain Morrison and a security detail went to assess the situation. They returned 3 hours later with authorization from Division Command. The wounded Germans would be transported to our facility for treatment, but there was a condition. Morrison gathered the German medical staff, me, Oberschwester Kraus, Stabsarzt Weber, the other nurses, and explained through Private Schmidt, 63 German wounded are being brought here. Critical cases. They're your countrymen, your former comrades. Some of you might even know them. Division wants to make a gesture. Allow German medical personnel to take the lead on treating German patients, with American oversight. Show that we respect medical professionalism. Show that the Geneva Convention means something. He paused, looking at each of us. But here's the reality. We don't have enough American medical staff to supervise all of you simultaneously, which means we're going to have to trust you. Trust that you'll treat these patients according to medical standards, not try to help them escape, not use this as an opportunity for sabotage or intelligence gathering. We're going to give you supplies, give you authority, and trust that you'll do the right thing. Oberschwester Kraus spoke. Why? Why trust us? We're prisoners. We're the enemy, because you're medical professionals. Morrison said simply. And for 3 weeks you've proven that means something to you. You've treated American patients. You've worked alongside us. You've shown that your oath as medical personnel is more important than your nationality. Now we're going to find out if that was real, or if it was just survival instinct. He looked directly at me. Anna, I want you to head the German medical team. You'll have full authority over patient care, with me supervising. Can you handle that? I felt something crack open in my chest. Not breaking, but opening, like ice thawing after a long winter. You trust me? I asked. After everything? I've watched you work for 3 weeks, Morrison interrupted. I've watched you save German patients and American patients with the same level of care. I've watched you operate on an SS soldier you had every reason to hate. I've watched you become one of the best nurses I've ever worked with. So yes, I trust you. The question is, do you trust yourself? The 63 wounded Germans arrived that evening. I wept when I saw them. Not because they were wounded. I'd seen thousands of wounded by then. Not because they were German. Nationality barely mattered anymore. I wept because American medics were unloading them from American trucks, carrying them into an American-controlled hospital, with American supplies waiting to treat them, and American doctors had just given a German nurse, a prisoner of war, full authority to care for them. The enemy was entrusting me with the lives of my countrymen. The conquerors were giving me the tools and authority to save the people I'd served alongside. The Americans, who had every right to let these men die or treat them as the lowest priority, were instead making their treatment a demonstration of medical professionalism and respect for Geneva Convention. It was the most profound act of moral courage I'd ever witnessed, and it broke me completely. I worked for 18 hours straight that night. 63 patients, ranging from survivable wounds to actively dying. We triaged, we operated, we administered medications, we provided comfort when comfort was all we could offer. The German nurses worked alongside American medics. Stabsarzt Weber consulted with Captain Morrison. We pooled our knowledge, German medical training and American supplies, creating something neither could achieve alone. I performed 3 major surgeries that night, all on German soldiers, all with American medical supplies, all under the supervision of an American doctor who trusted me enough to step back and let me lead. One of the patients was a boy I recognized, Gefreiter Schmidt, from my division's infantry company. He was 19 years old, a leg wound, badly infected, gangrene setting in. Under normal circumstances, he would have lost the leg or died from sepsis. But we had penicillin. We had surgical tools. We had plasma for blood replacement. We had everything we needed to save him. Schwester Anna? he whispered when he recognized me. Is that you? Are we captured? Yes, I said, starting an IV line. But you're safe. We're going to treat your leg. The Americans have medicine. Real medicine. You're going to be fine. The Americans? His eyes widened with fear. They'll torture us. No, I interrupted firmly. They won't. They're going to treat you. They're going to save your leg if they can. I know you've heard terrible things about them. I believed those things too. But it's propaganda. Lies. The Americans are medical professionals, just like me. They follow the Geneva Convention. You're a patient now, not a prisoner. Just a patient. He looked at me with those young, scared eyes. I don't understand. Neither did I admitted. But I'm learning. Now hold still. This injection will hurt, but it's going to save your life. By dawn, we'd stabilized all 63 patients. 3 had died despite our efforts, their wounds too severe, arriving too late, but 60 survived who would have died without American intervention. I found Captain Morrison in the corridor, drinking coffee that smelled like heaven and looked like mud. He offered me a cup. I took it gratefully. You did good work, he said. We did good work, I corrected. Your supplies, your supervision, your trust. I couldn't have saved them without all of that. Maybe, Morrison said, but you're the one who did it. You're the one those soldiers will remember, the German nurse who used American medicine to save their lives. You're the bridge, Anna. You're the proof that we can work together, that medical professionalism transcends nationality, that the Geneva Convention isn't just words on paper. He paused, then added, Division is talking about establishing a joint German-American medical facility, using captured German medical personnel alongside American staff, treating both sides wounded. They're calling it a model for post-war cooperation. You'd be part of that, if you're willing. You want me to keep working? After the war? With Americans? I want you to keep being a nurse, Morrison said. The war's almost over. Germany's going to need people who remember how to be human, who remember that some things are more important than politics. Medical care is one of them. Will you help us build that? I thought about the 63 patients sleeping in the ward behind me. I thought about the American soldiers I'd treated, the German soldiers I'd saved, the SS trooper I'd stabilized despite every reason not to. I thought about 3 weeks of learning what it meant to practice medicine without the poison of ideology corrupting every decision. And I thought about my brother Heinrich, somewhere on the Eastern Front, or dead on the Eastern Front, and what I owed him, and what I owed all the people who died in this stupid, pointless, evil war. Yes, I said, I'll help, because someone has to remember that we're supposed to heal, not harm. Someone has to rebuild what we destroyed. And if the Americans are willing to let a German nurse help with that, then I'd be a fool to refuse. Morrison smiled. The first real smile I'd seen from him in 3 weeks. Welcome to the team, Nurse Hoffman. April 15, 1945. 3 weeks after the 63 wounded arrived, Germany was collapsing. Hitler was in his bunker. The Russians were entering Berlin. The Western Allies were advancing on all fronts. The war was ending, not with glorious last stands, but with quiet surrenders and the realization that everything we'd fought for was ashes. Our hospital had become the model Morrison predicted. A joint facility where German and American medical personnel worked together, treating both sides wounded. We had proper supplies now, proper facilities, proper respect for medical ethics. But it was the small moments I remembered most. An American medic teaching me the correct English pronunciation of medical terms so we could communicate better. A German patient thanking an American doctor for saving his life. The 2 men shaking hands across the divide of nationality. Corporal Jensen showing me photographs of his farm in Iowa. Me telling him about Berlin before the war. Both of us imagining futures that might actually exist now that the killing was ending. Captain Morrison recommending me for a position with the Allied Medical Service post-war, writing that I was one of the finest nurses I've had the privilege to work with, regardless of nationality. The Waffen-SS soldier survived. He was transported to a POW camp for processing. I never learned what happened to him. I hope he lived long enough to face what he'd done. I hope he found a way to live with it. I hope he changed, but I don't know. All I know is that I saved him. And in saving him, I saved something in myself. May 7, 1945. Victory in Europe Day. The war in Europe ended while I was changing bandages. No ceremony. No grand moment. Just a German officer coming through the ward announcing the unconditional surrender and then continuing our rounds because the wounded still needed care regardless of whether nations were at war. I stood in the courtyard that evening, watching American soldiers celebrate, watching German prisoners sit in quiet despair, and feeling something that wasn't quite joy or sadness, but something in between. Captain Morrison found me there. "What are you thinking?" he asked. "I'm thinking about all the people who didn't survive to see this day," I said. "All the patients we couldn't save. All the soldiers on both sides who died for nothing. All the lies we believed that led to this." "Yeah," Morrison said quietly. "Me too." "What happens now?" I asked. "To me?" "To the other German medical staff?" "Now you help rebuild," Morrison said. "The occupation authority needs medical personnel. People who understand both German and American medical practices. People who can bridge the gap. People who've proven they care more about healing than politics. You interested? You're offering me a job? Working for the occupiers? I'm offering you a purpose," Morrison corrected. "Germany's going to need doctors and nurses who remember what medicine is supposed to be. Who can teach the next generation that healing transcends nationality? You've already been doing that for 2 months. Why stop now?" "Because it means admitting we were wrong," I said. "About everything. About the war. About the enemies. About what we were fighting for. It means standing up and saying, I served the wrong side. I believed the wrong things. And now I'm going to help the people who defeated us rebuild what we destroyed. That's collaboration. That's treason." "No," Morrison said firmly. "That's redemption. That's choosing to be part of the solution instead of remaining part of the problem. That's remembering that some things, like medical ethics, like the sanctity of human life, like the oath we took to heal, those things are more important than nationality or pride or what anyone thinks of you." He paused. "You want to know what I see when I look at you? I see a woman who was taught to hate, who served a regime built on hate, and who chose, when given the opportunity, to heal instead, who treated enemy soldiers with the same care she gave her own countrymen, who operated on an SS soldier she had every reason to let die, who wept when we trusted her with her countrymen's lives, not because she was sad, but because she understood what that trust meant. I see someone who's already chosen redemption," Morrison continued. "Now the question is, will you keep choosing it, even when it's hard? Even when people call you a traitor? Even when you have to face everything Germany has done and everything you were part of?" I thought about Gefreiter Schmidt, the boy from my division, who'd recovered from his leg infection and would keep his leg because American medicine had penicillin. I thought about the 63 wounded who'd arrived under white flag and survived because we'd worked together. I thought about the countless patients, German and American, who'd lived because medical professionals chose to transcend nationality and just do their jobs. And I thought about Private Collins, the American soldier who'd been terrified of me at first, who'd said, "She's not a Nazi, she's just a nurse." Was that true? Could it be true? Could I be just a nurse? Or would I always be a German nurse who served the Wehrmacht, who enabled the system, who stayed silent while evil happened around her? "I don't know if I can be redeemed," I said to Morrison. "I don't know if what I've done, helping you, treating American soldiers, working with the occupiers, if any of that erases what I was part of." "It doesn't erase it," Morrison said. "Nothing erases it. But it means you're choosing to be something different going forward. That's all redemption is, Anna. Choosing to be better than what you were, even when it's hard, even when it costs you, even when no one forgives you for what you did. Then yes," I said. "I'll help. I'll stay. I'll work with the occupation medical services. I'll teach. I'll heal. I'll do whatever I can to make sure that what I learned here, about medicine transcending politics, about treating enemies as patients, about the power of choosing mercy over revenge, I'll make sure that survives." Morrison nodded. "Good, because we're going to need you. Germany's going to need you. The world's going to need people who remember that we're supposed to heal, not harm." Epilogue, 1946, 1960. I worked with the Allied Occupation Medical Services for 3 years, helping establish civilian hospitals, training new nurses, rebuilding Germany's medical infrastructure. It was hard work, made harder by the looks from Germans who saw me as a collaborator, by the Americans who never quite trusted me, by my own memories of what I'd been and what I'd enabled. But I kept working, because that's what nurses do. In 1948, I enrolled in medical school in Hamburg, paid for by a scholarship from the Occupation Authority, recommended by Captain Morrison, who'd written, "This woman has more practical surgical experience than most residents. She deserves the opportunity to become the doctor she's already proven she can be." I became a physician in 1952. I specialized in trauma surgery. I taught at the university. I trained a generation of German doctors and nurses in the principles I'd learned from Captain Morrison, that medicine transcends politics, that patients are patients regardless of nationality, that the oath to heal is sacred and inviolable. I never married. I never had children. My life was medicine. My redemption was healing. I stayed in contact with Captain Morrison until he died in 1958. Heart attack, age 53. Too young, but not surprising given what he'd lived through. At his funeral, his widow gave me a letter he'd written years earlier, to be delivered if he died before me. "Dear Anna, if you're reading this, I'm gone," which means you're still there, still healing, still teaching, still being the bridge between what was and what could be. I want you to know, you made me a better doctor. Watching you choose to heal, even when you had every reason not to, even when it cost you everything, even when you knew you couldn't be forgiven. That taught me what medicine is really about. It's not about saving the ones who deserve saving. It's about saving everyone. Because the minute we start choosing who deserves life, we become the monsters we're fighting. You understood that before I did. You taught me that. Thank you. Keep healing. Keep teaching. Keep being proof that people can change, that enemies can become colleagues, that redemption is possible even when it seems impossible. The world needs that now more than ever. Your friend and colleague, Thomas Morrison. Final reflection, 1975. I'm 66 years old now. The war ended 30 years ago. Germany rebuilt. The occupation ended. We became allies with the Americans, partners in NATO, friends where we'd been enemies. The hospital at Remagen, where I learned these lessons, is gone, demolished decades ago, replaced by modern buildings that hold no memory of what happened there. The soldiers I treated, German and American, are middle-aged or dead. The war is history now, taught in schools, remembered in ceremonies, fading from living memory into the past. But I remember every patient, every surgery, every choice. And I remember the moment I wept, the moment that defined everything that came after. It wasn't when I was captured. It wasn't when Captain Morrison first let me continue practicing medicine. It wasn't even when I operated on the SS soldier I hated. It was when American medics let me treat our wounded. When they trusted me with my countrymen's lives. When they gave me the supplies and authority and respect to be the nurse I'd always wanted to be, even though I was their prisoner, their enemy, their defeated adversary. That moment, that impossible, beautiful, devastating moment of trust, broke open everything I thought I knew about enemies and allies, about winners and losers, about what it means to choose mercy when you could choose revenge. The Americans could have let those 63 German soldiers die. They could have treated them as the lowest priority. They could have denied them care as payback for what Germany had done, what the Wehrmacht had done, what the SS had done. But they didn't. They chose to be better than that, better than we'd been, better than war-made people. And they let me help. They trusted me to be part of that choice. That's what broke me. That's what redeemed me, if redemption was possible. That's what taught me that the real victory wasn't defeating Germany. It was refusing to become like us. Refusing to let hate win even when hate had earned its victory. I'm a German doctor now. I was a German nurse POW. And I wept when US medics let me treat our wounded, not because I was grateful, though I was, not because I was relieved, though I was, but because I understood in that moment what moral courage really looks like. It looks like trusting your enemy. It looks like giving tools and authority and respect to someone who fought against you. It looks like proving that some things, Medicine, ethics, the sanctity of human life transcend the politics and hatreds that divide us. Captain Morrison taught me that. The American medics taught me that. The 63 wounded soldiers taught me that. And I've spent the last 30 years trying to pass that lesson on, trying to teach young doctors that healing transcends nationality, trying to show them that the patient in front of you is just a patient, not a German or an American or a Russian or anything else, just a human being who's suffering and needs help. Trying to prove that people can change, that enemies can become allies, that the things we do during war don't have to define who we are after. I don't know if I've succeeded. I don't know if redemption is real, or if it's just something we tell ourselves to live with what we've done. But I know this: when American medics let me treat our wounded, they gave me a gift more precious than mercy. They gave me a purpose. They gave me proof that healing is stronger than hate. They gave me a reason to keep going when everything I'd believed had turned to ashes. And I've tried to honor that gift every day since. By healing, by teaching, by choosing, over and over again, to be the person they believed I could be, instead of the person I was. That's what I learned at Remagen in 1945. That's what I've been trying to teach ever since. And that's why, 30 years later, I still weep when I remember. Not from sadness, not from gratitude, but from the overwhelming power of witnessing genuine moral courage in action, and being given the chance to be part of it. The war ended, but the lesson continues. Heal everyone. Trust the oath. Remember that medicine transcends everything else. That's what Captain Morrison taught me. That's what I'm teaching the next generation. And that's what will survive long after all of us who lived through the war are gone. Because some things are stronger than hate. Some things are more powerful than war. And healing, the simple, profound act of treating suffering as suffering, regardless of who's suffering, is the strongest and most powerful of all.